Over the last 30 years, remarkably little has been done to document the history of financial, therapeutic, and operational policy with respect to addiction and behavioral treatment. As part of our mission, C4 has developed a series of films capturing this important oral history.
I work for the National Association for Children of Addiction. Our mission is to work for the children and families who are impacted by addiction and to eliminate the negative consequences that they suffer because of it. That's what our focus is. We work to change the attitudes and the behavior of people who make decisions about children and families, particularly children. So that in the court system, if something is happening to a mom or a dad in the court system, we are not equipped to protect and save the family relationship, nor to protect and save the individual children. There's a system where they go, which is called the foster care system, and which is not the best place to grow up. So we fight to develop programs that can help their families get well faster so that the children can be reunited with at least one parent, if not both, and life can go on. We work in the faith community trying to educate them in a way that they come to understand that most of the issues that impact the people in their congregations are issues that somehow or other tend to be related to alcoholism or drug dependency of some kind. There's been a lot of attention that's been brought to that currently because of the opioid crisis, but we really are in a constant addiction epidemic in this country. Opioid just happens to be the loudest noise at the present time. And it's caused people to be rethinking when they hear about addiction. There seems to be less blaming the victim than there was before, and we work very hard to make sure that kids understand that their parents have a disease that's rooted in the brain that has taken over their brain and made it impossible for them without help to stop drinking or using drugs, and that the children, it's not their fault. There's nothing they could do to correct it. What they need to do is to find safe people, and we hope that we have educated people who in the systems that could help them find safe people so that they can grow up and have a balanced life, no matter what happens to their parents' addiction. But the hope is always that the parents will get the treatment that they need or whatever services they need for recovery, especially the recovery support. We go through all the systems like that in a way. We work in the education system. We've done a great deal of training and produced some material on student assistance programs, which provide educational support groups for children of substance abusers and other kinds of educational support groups that are causing children problems that interfere with their capacity to learn and therefore interfere with the school system's work. So if a youngster's late to school because mom wouldn't wake up and the baby needed to be taken care of, that child's not going to talk about that and then will be punished too frequently for not coming to school on time, for being irresponsible, when in fact the child was being very responsible, but is trapped in this system where he can't say anything. And so we work with the schools. We just reproduced a kit for educators, all about what it was like for children of addiction and how they might present themselves and what the schools could do and what you could do in the classroom to help them. And most recently, we worked with Sesame Street and have been helping them with their huge website that produces tools for educators to help children with very serious social problems, because they have just decided to create a Muppet called Carly, and she was released just recently. And she will become a historic Muppet, like some of the people you will be talking to are historic people in the field. We worked with social workers to create core competencies for them And we facilitated it, but what they did was decide what they needed to do. What were the minimal competencies that social workers need in order to properly see and address the problem of addiction that is usually right under their nose in almost every case they deal with. But they weren't taught to do that, and so they haven't done that. It's getting better. Everything is getting a little bit better because of the horrendous crisis with opioids, but the addiction crisis is an ongoing horrendous crisis. But we have the attention of the media, which makes it possible to have attention of Congress. And so today, these times, I think, will be seen as partially historic because they are growing on the beginning awareness that addiction is this brain disease, and that there are a variety of pathways to recovery. All of them work. They work different ones for different people. But all of those people on the pathway to recovery, and not all of them, but most of them, have children. And those children have been traditionally ignored. And so 35 years ago, we formed our organization, the National Association for Children of Addiction, to try and get the people who made decisions about the children directly or about their family systems without taking into account that these children are being profoundly impacted in ways that will color their entire lives. One of the things that has changed the awareness of the serious trauma and chaos that children of addicted parents have forever lived in, this is not new, is the Adverse Childhood Experiences study that came out about 10 or 15 years ago from the CDC and Kaiser Permanente. And that study finally gave absolute scientific credibility to what we knew at NACOA from the day it was started, because it was started because we knew it, that children living in chaotic families where fear and confusion seemed to be prevalent, grew up differently, had different world visions, and struggled on many planes going through life, whether they were from poor families or well-to-do families. To a degree, that was true for all of them. They kept the secret of what was going on in their family. I mean, there's always been this anonymity, secret kind of approach, which was deemed to be supportive to the person who's needing to recovery. But it's been extremely destructive to the children because they have been abandoned over centuries because all the focus is on the drinker or the drug user and the prime enablers with them. So NACOA's goal is to reverse these adverse consequences by helping children to understand all the messages that they need to get and to find ways to help themselves, to help take care of themselves, to find safe people to live with. We know from anecdotal history all the way through the field to now, as well as knowing it in studies, is that it usually takes one truly caring adult to be meaningfully in the life of a child who lives in one of these families. Helps the child to know the truth, to be honest about it, separates the hatred for the disease from the love for the parents, so that the children won't be so conflicted and they will be better able to understand. So those are the kind of messages we are working on from Sesame Street to the treatment programs. We advocate for educational support groups for the children of clients in treatment. We have advocated for that for many years. We produced many years ago a kit for running groups for these kids in treatment programs or in schools or in youth homes. Today we've updated it substantially, and that'll be a tool that probably will be serving the field at least the next 10 to 15 years. The truths in it are universal. They won't be changing. The kinds of activities that help children to come to grips with their reality are taught to them in a light way where they can have a good time while they're learning it, but it does get into them and change their view of the world, which helps them to protect themselves more, helps their brain development to be healthier than it is under the chronic emotional stress. What the Adverse Childhood Experiences study did was it showed us that children who live in a chronically stressful environment their brains literally from early childhood develop differently. And it is not in a healthy way. Their social and emotional development is certainly abridged at some point or other. Their ability to be connected in healthy ways to others is harder because their personal life is involved with living a lie in order to survive. Those are really terrific burdens to put on a developing little brain. And so that's why we go after the adults who can do something. Our first major effort to go after the adults in a system was we worked with a number of physicians, especially a doctor at Johns Hopkins who chaired it, and we had an initiative for the education of primary care providers. Went on for several years. Core competencies for primary care providers were created by teams of doctors who were leaders in the field. We just did the facilitation, made sure they understand what happens to children, and then went from there, published a supplement to the pediatric journal that lays it all out. Had quite a few educational programs at medical conferences, etc. But that's like an ongoing effort because new doctors are coming along, medical schools are churning them out, and this is true for the graduate training for social workers, for teachers, for everyone who is going into these systems. So that will never stop. If we stop, that job must never stop because it will profoundly impact not only those children, but it will impact behavior in classrooms. It will impact the capacity to be holistically healthy on the part of the medical and the mental health fields. It will cause more physical damage because the children's immune systems get compromised. Children who grow up in adverse childhood experiences, on average, die 10 years earlier than other people do, on average, because the chronic emotional stress causes problems with the immune system, and the immune system protects us from cancer and stroke and heart disease and other things, everything else being equal. Well, the protection goes away when the immune system is shot. And so that's the primary reason why the death rate is earlier for children who grow up in alcoholic families. But I think one of the greatest problems in our society is the generational transfer of addiction disease from grandparent, great-grandparent to grandparent all the way down. And if we go to treatment programs where they have any valid family services, and they bring in all the generations that are alive to the family program, that starts to spill out. And so the children today are the children of yesterday's children who never got help. And if you're one of those children, then you're growing up as an adult child, the way I was just talking about you. You are more prone to a variety of things. There's more family breakup among adult children of alcoholics than other adults, because growing up there was no capacity to develop the normal, natural connectivity systems that we do when we are developing families. Historically, I think that this was a watershed time right now, because of the adverse childhood experiences study and our coming to grips with the impact of trauma on the entire life of a person, the impact of chronic trauma in childhood, unless there is at least one caring adult who is intervening and helping. So what do I do and what have I done? I go after all those issues. NACOA, my organization, goes after all those issues, and we've had really some remarkable people who've worked on our board and who've helped. We have people from our advisory board who were among the founders of NACOA who still help with some of the material, some of the development of programs. The next program that we're going to have is a mini symposium at Johns Hopkins University in a few weeks, where Hopkins is bringing together a variety of people who've been doing very interesting research about children around a number of the social problems of today, including drug abuse and substance use disorders. And they're going to report a variety of things that they're finding. And what's going to happen is they're going to reconfirm again what we said when we started NACOA. The reason we were starting it was because of children living in these kinds of environments. It wasn't being recognized, and that they were surviving, some of them very well, by living a dishonest life every day of their life. Every time they answered a kid about coming over to play, they had to think, well, I don't know, I better, to themselves, I better go home and see if mom's sober, because if she isn't, then the little ones will be coming in, so then I can't go play. So I have to go home and see how my mother is, so I can find out if I can do something. And that's just day after day after day. That hasn't changed, except that the knowledge base in our society is beginning to change, triggered by the crisis of one drug, the opioid. And I remember when meth started to do that, but it only did it in other populations, in the youth population and with the rural America. What happened, what was different this time, which gave us the chance to be able to be heard by more decision makers because of the opioid crisis. The people started overdosing in the neighborhoods where people have a lot of clout. So it was middle America's children and affluent America's children who suddenly were finding themselves overdosed, and their families didn't like it, and neither did their neighborhoods. And so we started getting political noise, and then money followed political noise, and we'll hope that that money will do some of the things it was designed to do. That's a watershed time for us today. I don't know. I hope we don't miss all the opportunities that are probably there, and I hope that the public will not get as weary of it. They got weary of crack, and besides, crack wasn't in their backyard anyway, and they got weary of meth, and they got weary of cocaine. I hope they don't get weary of opioids before we rattle enough systems to make a difference to protect our children. Otherwise, I would be worried about the children of America and how they will be when they grow up. There will be more broken families. There will be more of all these things we have been trying for years to counteract, to protect the development of our children. Almost 40 years ago, I was chairing a committee for the Junior League of Birmingham, Michigan, which was funding a tremendous amount of really phenomenal programs for the protection of children who are at risk. One of the projects was a juvenile delinquency prevention program, and that was the one I was the most interested in because I was intrigued when I was asked to take over this work about how that related to anything that we were talking about. One project was child abuse and neglect. That was real clear because I knew where there was family violence, you had all this stuff. And one was a program, a research program with one of the local universities. This is in southeastern Michigan, the Detroit area. Was with mothers who had newborns who were totally incapable of nurturing their child. They couldn't hold the baby without losing him. They couldn't hold him. They didn't know how to talk to their child. They had total flat affect. And so we had a program with there. We had a number of experts in the field who designed a test program, and then these women had extensive education and worked one-on-one with them. And we did the same thing in the Juvenile Delinquency Project and the Child Abuse and Neglect one. What intrigued me in the Juvenile Delinquency one was how they determined who was at risk. And they wanted to prevent, before the children got into the juvenile justice, they wanted to reach the kids who were at risk for it. And so they went through their logs in the juvenile courts. And they really did all the things you ought to do to find out, to do a study like this. And they determined that children who were living in a family with a volatile divorce going on and who were in the adolescent age group, middle school age group, they were the most at risk to be tomorrow's juvenile delinquents. Nobody asked why. The researchers who set it all up only saw, violence in the home. And the children were living in that. That was the one factor So nobody asked why there was violence in the home or what else was accompanying the violence, because they were processing the divorces. And we just wanted to supposedly to protect, put a shield around that child whose parents were fighting and all kinds of arguing and everything going on with the divorce. And so one day we periodically had meetings where people told the human stories of what they were doing. And so, in other words, the volunteers were all teaching each other by giving examples of what happened and how they'd applied the principles of the training that they had. And all of a sudden I stopped the meeting and I said, I wonder if any of you are hearing what I'm hearing. I keep hearing lots of drinking, alcoholism, alcohol everywhere, in every story. You'd be telling about the incident that you dealt with, and the father came home drunk, and you dealt with this, that, and the other thing. And I said, and somebody else talked about the mother being passed out on the couch. And I said, do you hear that? And there was some nodding around the room, and it was like, it was a genteel crowd. They didn't talk about things like that normally in our society 40 years ago, and we didn't. All across this country, we didn't have these conversations. They said, well, maybe that's an issue. And so our league had spent a fortune paying for the training and paying for the surveys and setting up these programs to try and help the community address some problems that were keeping children back. We said, we need to maybe ask if we shouldn't be doing something else. And so there was kind of this general agreement in the group, maybe if we could find a way to educate the people who are making the decisions that take us to these conversations. The ones who are making the decisions about foster care, they're making the decisions about everything. These are all, they're judges, they're probation officers, they're teachers who are giving their opinion. Maybe they don't know anything about alcoholism because it seems to be involved in all this and nothing's changing. And I don't know anything about alcoholism either, so that makes all of us. And so I asked if there was anyone in the group would object to my going back to the leadership and saying, we have a concern from this group of really smart women that were coming to conclusions on their own, and maybe we could do something to help people who are making the decisions to be better educated. We didn't know what we could do, but could we go in that direction? And they said yes. And then I said, we need to do some learning, and we need to find some conferences that are going on where we can attend and then talk to experts who present. They paid our way. We went to a number of them. We went to the NCA conference. That was the biggest educator of the country back in those days. Doctors, researchers, everybody went to NCA, the National Council on Alcoholism, for their education. And we went to some family systems conferences, and within 2 or 3 months, we said, we're on the wrong page, and this is what we need to do. We don't know how, but we need to find out a way. I was leading that charge, and I went to school along with everybody else. And at the same time, Henry Ford Health System in Detroit, which was a major hospital system, was building a residential alcoholism treatment program. Coincidentally, we were doing our work, and they announced that the thing was going to be coming the following year. So somebody from the hospital, I think it was the president of the hospital, met somebody that knew about our work, and they were at a party and they had a chit chat, and the next thing you knew, I got a phone call, and could we talk? And so we ended up establishing a collaborative program with them. We put the name of their hospital on it, but we made it very clear that this could be beneficial to them on getting clients, and we would do not one thing to do that, because we're not here to get clients for anybody, even our partners. We're here to educate the community and to have your support to do that. And they were pretty good about that. And we started in, and we were fortunate that they were hiring a medical director who had just recently been one of the National Institute on Alcoholism and Alcohol Abuse's career teachers in the medical schools. And he was the one assigned to the University of Pittsburgh Medical School, and he'd been learning and teaching about alcoholism. That's what he was doing there. And they had just hired him to be the medical director for the Maple Grove program. So we got him as our primary instructor for the first year of training the volunteers. and he was a really terrific teacher. And then we started meeting people around town who were various kinds of experts, people who worked in other treatment programs. There was a woman named Stephanie Abbott who was in the field for years. She headed up a family program at Brighton Hospital in Michigan, and so she came and started teaching in some of the programs that I was establishing. I just found, I went looking, I always look for experts because I don't know what I'm talking about when I start. And we started doing community education. Those were the days that what was going on historically at that time was the adolescents, the 7th and 8th graders in this country were getting introduced to pot. And little crowds of boys and girls were hiding in behind bushes and in the neighboring park, and they were getting pot. So that was when marijuana started hitting the kids. And so people were paying attention. And as a result, Isaiah Thomas, a famous basketball player that played for the Detroit Pistons, was asked to be a spokesperson. They did some really good things. They got some good advice, and they put flyers in the bills that went to all of their clients. And only one flyer, and the world changed for them because the Detroit Edison telephone companies were ringing off the ear with concerned parents and neighbors calling about the terrible drug problem, these kids smoking dope, and now they're drinking alcohol, and Detroit Edison didn't know what to do with it. And by that time, we had our program up and running for 3 or 4 years, and so it was pretty well known because we were the only people who could do educational prevention programs that had any training in doing it. We had about 200 volunteers that went through a 6-month educational program so that they were casually conversant in the disease of alcoholism and in the impact on families and children and on intervention. We could send them anywhere. We did 40 or 50 educational programs on many weeks all over southeastern Michigan with volunteers who were highly educated, and they did little kiddie 1st and 2nd grade programs with simple little concepts, and they did complex whole day, half day seminars. We planned them all, and it was doing a lot of good. It was waking people up. Programs started in schools, coalitions started to grow. But it was all because of children of alcoholics, and I didn't even know that term, children of alcoholics, when I went to the league leadership and asked. It just wasn't in my vernacular. I didn't talk to anybody who ever talked about that. And so then that spread to other schools, and then a group of school people asked me to develop a professional training organization so that school professionals could get seminars and learn all about it so that they would be collaborative, not be roadblocking any programs that came into the schools. And many of the school systems instituted comprehensive student assistance programs with a lot of emphasis on children of alcoholics groups. So these kids got helped early and things changed. There was better graduation rates, there was better academic behavior, all the things you're looking for. But I was looking for helping the kids. And the people that we worked with most of the time benefited from working with us. And I think that's still true. When we work with them to decide how to do what they need to know, that's how we approach all of our programming at NACOA. And that's what drove the thought to have the symposium at Johns Hopkins, for example, in the near term. Once in a while, people say, "What's your story?" And I think, well, I don't want to really tell my story because they think I'm going to tell them a horror story about growing up in an alcoholic family. But actually, I grew up in a family where there were high expectations and high results and lots of love and lots of fun. And I was very fortunate. I grew up and I got my name from that family. I have 5 brothers, so I became Sis forever. And I will always be grateful for that because I think that it's easier. Well, I may not have that feeling of the pain that addicted people and their children feel, but if the discussion includes people who grew up in healthy families, then they bring a perspective to the discussion that I think makes it better for the people we're trying to serve. I frequently get asked questions that I can't imagine anybody would ask me because they were not things I had ever thought of. About, what did you do when? Well, those whens never happened. And they didn't happen in most of the homes in the neighborhood where I left, which was a working class factory, mostly a few professionals sneaking in to these little houses that were built after the First World War. That's what got me in it. That's what I did. I thought, if we aren't training the people who are going to make the decisions in our systems all the way up to the courts, we're going to just keep doing this. One of the biggest disappointments I've had is to come to the realization that every 10 years you have to do it all over again, because we haven't yet changed all of the professional training schools. So frequently I'll find an enlightened judge. I love working with the courts because, in my view, there's nothing like a judge to work with. If you can show him that you're going to keep his desk cleaner and fewer people are coming back, he's going to love you and do what you ask him to do. So I became the lead substance abuse trainer for the Michigan Judicial Institute for about 10 years in the middle of that was the group I wanted to educate. So when they came along, I said yes. And I've always been glad because I watched the courts change their behavior. They changed their rules. This conference that I'm at right now is helping people like that to change. Now they have a new understanding and that there's hope to do something they'd never conceived of doing before. And they're finding that it's going to work. And so that's very motivating to be in the field for me, because we are always trying not to fix one child, but I would if I needed to, but not to fix one child, but to fix the systems that help all children mature, so that everybody gets a fair shake. There are lots of relatively effective, not too time-consuming advocacy work that can be done in any field in a serious human cause. So we need to parcel the time to be where you need to be that can make the biggest difference. We need to work harder in our field to train the people who are coming along and to find more people to come along, because it's really an admirable disease and family systems problem to work on. And I think that's getting better. I think that not because it's getting more professionalized, but because it's becoming more accepted that even if you don't understand that it's a disease, you're not willing to learn how that works, you are aware, among the general public, you are aware that this is a fixable problem, that it isn't leave them alone and let them die like it used to be. And so if it's a fixable problem for the parents, I hope and pray that people will begin to realize that because they can't see the pain and they can't hear the child's thoughts, and the child is behaving nice and well and getting all A's maybe, that they should not assume that, well, he turned out all right, he's going to be fine, because they aren't fine. They carry that pain through their lives, keeping those secrets, and it impacts their capacity for healthy relationships, which then causes more divorce. The Secretary of the Health and Welfare Department in about 1975, maybe around that time, maybe 1980, testified before Congress that alcoholism was the greatest killer of Americans, and the second highest killer of Americans was being an adult child of an alcoholic. I could not believe it when I read that, and very little was made of it in the press. I don't think the media knew how to deal with that. There wasn't any of the studies about trauma out. And I have a theory about stigma, and that is that the more that we try to keep secret, the more people feel that there's something wrong.